Hello all. My topic for discussion this week is a GI assessment. First of all, a good GI assessment can give you many clues to what's going on with your patient. And the number one step in the nursing process is assessment, then diagnose, planning, intervention, and evaluation. So first we can go, not only is this an abdominal assessment, but it also has to do with how they're getting food and nutrients in and how they're eliminating them. So we can start off with, this is my nursing assistant, Ava.
Hello.
So for food and eating, we want to make sure that everybody's getting their proper amount of fiber. Is your patient's weight, is their BMI in the normal range? Is it, are they overweight, are they underweight? Are they meeting caloric intake for their body? Do they have healthy choices? It's always good to think about socioeconomic status. You know, if someone is homeless, they're not going to have choices of fresh fruits and vegetables like someone on the wealthier end of the spectrum. And education. Some people just honestly don't know about what they're putting in their mouths and how it can affect their whole total health. BM patterns. Do they have chronic constipation? That's really prevalent in our older folks. What's your patient's normal pattern? Some people don't go have a BM every 4 days. That's normal for them. Some people have 3 bowel movements a day, and that's normal for them. So you need to find out by talking with your patient what's normal for them. A warning sign, like we went over last week, is a sudden change in bowel habits. Or if they have some kind of a blockage, they could be suddenly passing very liquid stools if they haven't, if they're impacted in some way, because the liquid stool will go around what's blocking. When to know if you're going to need your interdisciplinary team. Speech therapy, do they need help swallowing fluids and foods to meet their nutrition goals? Dental, can they chew properly? Are they in pain? Do they have ill-fitting dentures? Because that can really affect if someone wants to eat and meet their goals if they can't eat because it's so uncomfortable. Occupational therapy, do they need assistive devices to eat, to help them eat? And dietary, eating proper foods to promote healthy elimination. Again, the fiber, and making sure that things are like appealing to them. Some people, like, if they have to have like pureed foods, they're not going to want to eat it if it looks gross. I wouldn't want to eat it. Okay, this is my section of the abdomen. We have the upper quadrants and the lower quadrants. So we'll go over here. Inspection first. You're going to look at the abdomen. Is there any scarring, bruising, distension? Have they had any surgeries in the past? How do they present? Like, are they guarding? Are they uncomfortable? Do they have a chronic condition like ascites with liver damage? Is their belly big and round? Is it hard looking? Auscultation, you're going to want to listen at each quadrant. You're licking, oh Lord, clicking and gurgling over each quadrant to tell you like if they have movement going on in there and if the food is going through. Some people can have hypoactive or hyperactive. Hypoactive is when the GI tract is sluggish, and hyperactive you would hear in like someone that has diarrhea or that's having lots of bowel movements. Percussion is tapping gently over the abdomen. You're listening for any abnormal sounds. They could be masses in the abdomen or fluids. So you want to gently do that. Then palpation, there's light and deep palpation. You're going to want to assess for pain first. You don't want to be pushing on someone's belly if they're going to be in pain. And you want to palpate in the area of least discomfort first, and then the most discomfort after, lastly. And you're also feeling for any enlarged organs, any masses, any abnormalities. And that is it. Thank you, Ava. This is GI Assessment.